Dr. Charlson, you've worked with both cardiovascular patients and cancer patients.
Yes, I have.
And studying the effects of expectancy, mood, positive expectations.
Well, we've studied in cardiovascular disease patients, we've looked at a simple positive affect self-affirmation intervention and whether it gives people tools necessary to assist them in making and sustaining behavior change. So the positive affect intervention is a simple statement, asking people to take a moment when they first get up in the morning to think about something that makes them feel good, and to do that, to think about that and other things that make them feel good throughout the day. So it's a fairly straightforward intervention, and we've shown that it actually does increase positive mood states. The self-affirmation intervention asked people to think about a time when they tackled something that was difficult, but they were very proud of their accomplishments when they hit a barrier to behavior change. And the kinds of things that we looked at in terms of behavior changes were increasing physical activity and increasing medication adherence. And in patients with chronic cardiovascular disease, those simple interventions resulted in patients walking miles more a week. And so the positive affect self-affirmation intervention was an important predictor of the ability to make and sustain lifestyle changes, which are important to prevent recurrence in cardiovascular disease patients.
Yeah. And what's interesting is, the very definite result there, very visible, and maybe a comment that affirmation is not, self-affirmation is not what in some everyday language is called affirmation, which is stating a positive statement which may not have any basis on reality, like, oh, I can accomplish anything. But this is something in which the person is encouraged to look at either something that truly feels good for them or something that they truly accomplished, they feel good about.
Right. And they feel proud about, and that they can draw on. Yes, I've overcome obstacles successfully in the past. It helps people address negative stereotype threat. Claude Steele has done a lot of work about negative expectations. If you have negative expectations for your performance in a test, it's not helpful to you. But if you're able to draw on previous successes, it can be extremely helpful.
Yeah, so we're talking about shifting the focus, that the bias for people would be to pay attention to the negative expectation, but this is an exercise in which they're helped to shift focus towards something where the database was actually a positive experience.
Yeah, something that they'd already done, and they graduated from college, whatever it was.
Mm-hmm. Mm-hmm. And so this was done, just simply telling people to do it, and they were doing it on their own, without any help or being watched. Doing it simply, they were following that.
We gave them a little sticker magnet for the refrigerator. But yes, and people reported using the positive affect strategy often. And I think although I have no evidence about it, I think it does two things. First, in order to take a moment to think about something that makes you feel good, you have to be in the moment. You can't be worrying in the back of your mind about whatever is going on. So you have to be present. And I think thinking about something that makes you feel good provides a mood boost. So it helps to reset positive mood.
Yeah, gets you out of the loop and actually more specifically in that positive mood.
Yes.
And to observe these positive effects, for how long did people do that? How was it over a period of how long that?
Follow them every 2 months for a year.
Okay, so did you notice ongoing improvement, or did that move slow and plateau, or fast and plateau, or?
People adopted it and began to, they sustained, like I said, miles more a week in terms of primarily lifestyle physical activity.
Mm-hmm. Mm-hmm. And so can we, from that, either from these studies or from other studies, infer that that kind of a positive attitude can help heal?
Well, I think it helps. What we can say is that it helps people make and sustain behavior changes.
Mm-hmm.
And behavior change is very important in terms of preventing, future progression of cardiovascular disease.
Right. So it's not a direct link. It's not the positive then itself improves the chances of cardiovascular disease, but the change in behavior is then going to do that. So short of having that behavior change, is there any indication that the positive attitude itself will make people more likely to heal or to do better?
There's a huge literature on what the impact of positive mood is, and there's also a huge literature on what the impact of negative mood is. And it's not an inverse relationship. So, the positive mood helps buffer against the adverse effects of stress. So you're more likely to sustain behavior change when you're hit with some interval event, which is troubling or, life hassle. You're more likely to be able to handle it without reverting to your previous lifestyle or behaviors. And I think, there's a reciprocal relationship, for example, between increasing physical activity and positive mood. The more physical activity, the more positive mood, et cetera, et cetera.
Right. So it's introducing a virtuous cycle where there could be a vicious cycle.
Positive cycle, positive mood.
Yeah.
Increasing physical activity.
Yeah. And this is happening in the context of people who are cardiovascular or cancer patients. In other words, people where the threat is serious enough that it would understandably create a stress. We're not just talking about everyday thing that people could actually be put into a downward spiral because of the stress.
I think what happens is that if patients with cardiovascular disease, if they don't make behavior and lifestyle changes, have a recurrence rate at 2 years of 30% and need additional procedures, So it makes a big difference if they're able to make and sustain lifestyle change. We know from clinical trial data that people who are able to make and sustain lifestyle changes do better in terms of their outcomes. So, but one of the problems is that there's a widespread belief that after you go into the hospital and you have an angioplasty, for example, that, you're back to normal. But the reality is that the underlying atherosclerosis is a systemic illness, which can be ameliorated or the progression reduced with the behavior change. But if you don't do it, you're likely to have trouble in the future.
Yeah, you're back to square one. You're not changing the conditions that brought you there in the first place.
Right.
Right. And so it's about, again in here, facing the reality of the threat without being so overwhelmed by the threat that you're paralyzed by it. And the hypothesis is that looking at the positive gives you a puts you back in touch with the experience that you can do it.
Right.
Mm-hmm.
Right.
So, any sense of what about maybe the people who are not doing that, who in the study are not doing it, or people who are, any hypothesis about what makes it difficult for some people to follow that approach?
I mean, I think in general, if there are life events that happen, that can throw people. But again, with the positive affect, you do better in terms of your ability to buffer against the effect of those in terms of behavior change.
Mm-hmm. 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 Yeah.
And it's the kind of intervention that works in cardiovascular patients because they're not going to, it has to be quick, and they're not going to, cancer patients will participate in, groups for 4 or 10 sessions, but cardiovascular patients who really think that they're pretty much okay won't. So this intervention lends itself to that group of people because it's quick to teach, it's very straightforward, and, people begin to see some benefits of it.
You see the effects right away. You see how your outlook is during the day, so then it becomes a self-reinforcing process.
Right.
And so what about cancer patients? How does it work for them to do that? The behavior the behavior change does not have as dramatic an effect as for a cardiovascular patient, does it?
In cancer patients?
Yeah, exercising, for instance, or doing something of that nature.
So in breast cancer patients, which we've done the studies in, the problem is that a significant percentage of women who have completed treatment for breast cancer have a post-traumatic stress disorder symptoms. So intrusion, avoidance, and that can have a huge negative impact on quality of life. They're afraid of recurrence, and that fear is not irrational because, there's an ongoing threat of recurrence up to 20 years in people who've been treated. Not huge, but it's real.
Mm-hmm.
But for people who spend their lives fearful that the next time they go to the doctor that they're going to be found to have recurrent cancer, living with that kind of fear is hard. And if you can teach people basic tools like the guided meditation that Dr. Luizzo has developed, it's made a huge impact in terms of their quality of life. And they will participate in a longer intervention because for them it is in fact the sense of existential threat that makes them want to deal with tools so that they can kind of deal with the reality of it, but not have it as a huge roadblock in their life and affecting every day.
Right. So facing that it's a reality, not ignoring it, not pretending it's not there, but at the same time not being overwhelmed by it, and so there's a sense of willingness to have a practice that allows people to live with that.
Yes.
And so you talk about it's a guided meditation. So what's it like? What's it consist in? Is that something then that requires being in a group? It's
taught in a group format, and the initial 4 weeks are really based on meditative skills, and the other weeks are so the first 4 weeks concentrate on basic meditation, and then the next that's taught as a block, and then the second block of 6 weeks deals with specific realities in terms of, life is impermanent for all of us, right? And if you accept that, then it gives you a way to frame the current experience, right?
Yep.
to live in the present rather than in, the worry mode of, that makes fear an everyday reality.
Mm-hmm, mm-hmm. And so, that the first block is basic meditation, and the second one, that sense of life is impermanent. Life is impermanent in the form of lectures, or how do people absorb that?
So, there are different skills that are taught in terms of that, but one is to reframe the experience, right?
Mm-hmm, mm-hmm.
So, there are two reactions in cancer patients. One, you can have this experience, and it can ultimately have a positive impact on your life, or you can have this experience and live with fear. And so you have choices to make, and, there are skill-building things along that way. And, a lot of people experience that, once they've completed treatment, their family expects them to be back to their old self, but they're struggling with who that self is in the light of the previous. So there are a series of, it's a developed, manualized program for breast cancer survivors and there are papers in the literature that describe the different kinds of sessions that Dr. has written.
Yeah, yeah. So it's not in a way just about, this is a bump in the road and here's how to cope with it. But, this bump in the road is actually something that creates a profound change in the sense of how I perceive myself.
Yes, that's correct.
Yeah. Yeah. And then, the guided meditation, is it at this stage or is it a later stage?
No, I'm not sure exactly what you mean.
Oh, you had mentioned that for cancer patients, it includes guided meditation. So is guided meditation one?
It starts with teaching basic meditative skills.
Okay.
Breathing and so on, and then it goes on.
Mm-hmm. And so once after these, couple of months of training, are people still doing this in groups, or are they doing it on their own?
It's been a combination of both. Some of the groups of women have continued to meet, and others, have done it individually. Not everybody in a group would continue to meet, but some have continued to meet,
mm-hmm.
and others pursue it individually.
And are there any indications of whether being in a group works better?
Well, we don't know. We haven't taught it individually, so we know it has a major impact on the experience of having post-traumatic stress symptoms.
Mm-hmm. Mm-hmm.
We've shown the intervention results in a very significant change in the symptoms of avoidance, et cetera, intrusion. But we haven't delivered it as an individual intervention.
Right.
I'm sure it had the same effect, but it's less practical.
Yeah. No, I meant you say after the group, after the group meets for these couple of months, some people might continue in a group, whereas some people continue on their own. So beyond the initial training.
Yeah, we haven't followed people.
Yeah. Okay. So, is there something that we might say in conclusion from this? As a.
I think there are some skills that people can learn. People who are dealing with chronic disease and the importance of making and sustaining lifestyle change to improve their long-term health. There's some simple skills that they can learn that we've shown can make a big difference in their life experience, and those are published in the literature, either under my name or under Dr. Joseph Luizzo's name.
Great. Thank you, Dr. Charlson.
Okay.
This recording is part of the podcast at relationalimplicit.com. Beyond the initial training.
Yeah, we haven't followed people.
Yeah, okay. So, is there something that we might say in conclusion from this, as a...
I think, there are some skills that people can learn, people who are dealing with chronic disease and the importance of making and sustaining lifestyle change to improve their long-term health. There's some simple skills that they can learn that we've shown can make a big difference in their life experience. And those are published in the literature, either under my name or under Dr. Joseph Luizzo's name.
Great. Thank you, Dr. Charlson.
Okay.
This recording is part of the Somatic Mindfulness and Relational Psychotherapy podcast. See the website relationalimplicit.com.